Okay, so today's lesson is going to be on the different types of myofascial lines. So first up, we're going to talk about the superficial back line. The superficial back line protects the entire posterior surface of the body. It attaches at the Achilles tendon. It goes up towards the hamstrings, past the thoracolumbar fossa, and it connects on the iliac crest, going upwards from the erector spinae. It continues going up past the neck and attaches around the eyebrow region of the head. So, the superficial back line creates extension and hyperextension. Some common postural faults are ankle dorsiflexion, knee hyperextension, and the hamstrings also shorten, and it can also cause an anterior pelvic tilt. So, for an example of a stretch using the superficial back line, would be trying to touch your toes. So right now, with his legs fully extended and his back moving downwards as he's pulling his head inward, he's going to be stretching the whole entire superficial back line. However, this situation is a little bit difficult for him, so a common modification that you can use is by stepping on something like a ball, a golf ball, or anything like that, something to give him support. And now as he stretches the superficial back line, bringing his knees inward, it should be a lot easier for you. Do you find it easier?
Yeah, a little bit.
Sounds good. Okay, so the next myofascial line that we're going to talk about is the superior front line. So the superior front line connects the entire anterior surface of the body. The anterior front line starts at the pangules, so the top of the feet, as it works its way up past the tibula fibula, going past the plexida, going past the biceps femoris, attaching at the rectoris abdominis, going up and across to the rhombus, continuing up to the sternomastoid and attaching at the back of the head. So, common postural faults with the front myofascial line is extended toes, dorsiflex ankles, extension of the knee, flex of the hips and trunk, and also some posterior planks is also ankle flexion as well. So I'm just going to move the camera just a little bit lower as we get into our next stretch that works the front myofascial line. So for this exercise, we're going to be needing you to sit down on the ground. So what you're going to be doing is you're going to fully extend your knees, and you're also going to flex your toes upward. And as you flex your toes upward, you're going to be bringing your head closer to your body. So right now, he's working the entire front myofascial line. Okay, so the next myofascial line that we're going to be talking about is the lateral line. So the lateral line will balance your foot and back. It's also responsible for lateral flexion and abduction of the hips, inversion of the foot. So it starts at the first intercostal bone as it works its way up past the iliac crest, going past the tensor fascia, and it works its way up past the gluteus maximus. It also expands as it passes this region, and it connects at the internal and external intercostal obliques. It goes up across the ribs, almost in a diagonal direction, continuing going up to the sternomastoid, and it stops at the upper region near the ear. So such problems with the lateral myofascial line are pronation, supination, abduction, and the rib cage will shift on the pelvis. So such an example of movement in the lateral myofascial line would be walking or swimming. You'll be working all these muscles. Okay, so the last myofascial line is the spiral line. So the spiral line loops around the entire body as it connects on each side of the skull. So this will help with balance, and it also causes movement in all different types of planes, like the frontal plane, sagittal plane, and transverse plane. So originally how it starts at the top of your head as it moves its way down past your neck, as it continues to the rhomboids, passing the scapula, going towards the serratus anterior, going towards your internal and external obliques, and it goes down to the iliac spine as it passes the tibular tract, as it works its way down to the hamstrings, going towards the foot and underneath the foot, as it continues back up around, passing the biceps femoris, and going up towards the iliac spine, and connecting with the superficial back line. So, some common postural faults are some lateral shifts, and a way that you could stretch the spiral line would be as shown. So, what I'm going to need you to do is I'm just going to get you to go down onto the ground as you stretch this leg forward and this leg back, and you lift your head upward. So right now, he's working the entire spiral line in each of these movements. Okay, so finally, what's unique about the superficial back line and superficial front line is that the superficial front line and back line help balance each other out. So, however, the superficial back line and front line connect on the head. So it passes the neck and it connects around here for the superficial back line and here for the superficial front line, which causes tension on the neck, which is why some of the common postural faults would be a forward head tilt. Also, the superficial back line, what's unique about this is oftentimes it cannot be stretched, so you got to make sure that your legs are fully extended. So example would be if you were to bend down and reach for something. Right now he's bending his knees, which is not causing a stretch with the superficial back line. Whereas if he were to keep his knees fully extended, it'd be causing a stretch with the superficial back line. And what's also unique about the superficial front line is that for the movements to be completely stretched on the superficial front line, you have to remain in the sagittal plane.